Briones and Fiber Program, which I'm the CEO, and Bear Doctor, which I'll explain a little bit later about our project of the old medicine and the new medicine and the approach to microplastics, pollution, and health. And so I have about like uh 35, 40 minutes, somewhere in that range. And then we kind of open up for some questions. I know it's going to be a lot and heavy, so that's why I wanted to present here at my home. This is my home, um, and at a comfort level. And this area is traditional land, a Pomo land, where the red bud and the medicine grows. And we call this area Dano Baten. And this area here, a lot of medicines and dreams come true. And this down below is Clear Lake, Habaten, and that's where most of the majority of the people live. But again, here in this area of Dano Baten is the home of the Bear Doctor. And I'll explain that a little bit more later. And that's part of our culture I want to share with you. So, yeah, it's 10:03 now. Again, thank you for joining. And we're just looking at a slide here, a home screen of our presentation and some baskets that I made from our area of Habatin, Clear Lake. And our baskets are our medicine, old medicine. And we'll talk about today our microplastics of old medicine baskets meeting new medicine at Stanford University, um, LaBeaud Labs. So I'll get started now. Again, thank you to everyone. And but before one thing, I want to just give special thanks to the water boards for accepting me to do this presentation coming out of the Water Quality Monitoring Council. But every year, the water boards invites me to the state capitol to show my baskets. And in the brochure, the pamphlet, it always says, Fred Briones, Pomo, Bear Doctor, to make dreams come true. And I hope to share that with you, to show you to our healing powers, our old Indian ways. So let me go to the next slide. So a little bit quick about myself. I'm from Big Valley, Pomo, the Bear Doctor, a basket weaver. I have a bachelor's degree in chemistry and MBA from the University of Hawaii in Manoa. And a lot of my early work was in the water, wastewater distribution operator in Hawaii, California, and New Mexico. And then I started my own business with First Nations Development Institute as a consultant. And then I helped with tribal people in California to develop the first California Tribal Fund that gives grants to tribal communities. I'm also the representative for the SB, or excuse me, California State Water Quality Monitoring Council and representative on SB 54 with Cal Recycle. And I'm the tribal leader at the Stanford University LaBeaud Labs Microplastics Working Group. And that's a basket that I made. And I wanted to show you my operator license because it's very important to understand that in the Pomo way, our traditional ways, our leadership comes from the water, the spirits. A lot of our chairmen that were previous chairmen at Big Valley all started at the water plant. So understanding those ways, it helps you learn plumbing, electrical, carpentry, shoring, policies, procedures, working with the crew, doing all different types of reporting, but most important, training other operators how to sample. So that is a major focus of our project because we're trying to collect, but understand the old leadership comes from the water. So here, I want to explain this. This is old traditional knowledge right here. This is 20,000 years old that I will explain this to you, how to become a bear doctor. From a very, very young age at our church, the Roundhouse, you are what is called doctored in. We do special Indian things to you. so that you're like baptized inside the roundhouse. And then as you progress in life, you're very young, where you're learning plants, animals, how to hunt, how to fish, and then as you get older, as you mature, you understand the plants are the medicine and how to start putting things together. That connection between the earth and the timing as you age even further, or you get into the miracle gift stage where you understand the plants, how to put it together for the medicine, and you are so connected with the earth that Mother Earth, it actually begins to speak to you in our ways and then provide gifts, miracle gifts. But the gifts are only with the power to heal. You must use to heal. In our ways, the baskets, the basketry, as you can see. So then, as you progress even further in that miracle gift stage where you're making medicine and helping others, then you're even gift even further with the suit to understand now. Now it's to symbolize to really go out and make it happen, make dreams come true. Things that Bear Doctor can do, no one else can do. Just like living here in this area of Danobatin, only Bear Doctor can live here. All our people know that. Only Bear Doctor can live up here. Everyone else lives down in the valley. So I'll go on to the next slide. So again, as Bear Doctor, to have your own business, to work right here with all these Fortune 500 companies. There I have my logo, the old logo when we very first started working with all these Fortune 500s and bioplastic producers at the center of bioplastics and biocomposites to think of ideas to synthesize different source materials to create widgets, single-use plastics, auto parts, papers, to have the source material, industrial hemp is what the tribes had, natural fiber as a replacement to plastic, to come together at university centers like this to research the ideas of widget creation. That is what we did there. But then it came a point where to be impactful, SB 54 came around and I had to make the choice, one or the other. So I chose SB 54 to be an advisor. But when I chose that, I never knew there's any money involved at all. I want to make that clear. So, but now that I do know there's money, to understand, to step back, the old traditional ways of California Indians having money for ourselves, that we had it, now the state to be transactional in these ways to understand our ways of money. And here's the shell money, and it's on the beach, and then the shells would crash and break into little pieces, and then we would collect it, and then we would run it through a pump drill to make a hole in it, which is called otiema. Once the shell had the hole, then we would hand roll it to make circular discs like this. Hooded a hood say. Then we would string the money, long strings of money, and be able to count into the hundreds of millions. And that's how we did it. That is our money. But then how do we use our money? In a medicine way, money jewelry like this on our basketry, and how far the travel of the money went in ours ways from the old religions of the roundhouse praying to Mother Earth when before the dams where travel was more easy on the tolly boats on the water, our money, our dances, and our roundhouses, and the people always would come to Clear Lake here, Habatin. They would come to Clear Lake and we would show them our ways, like how I do now today. I share with you. And here's Clear Lake. You see it in the back. That's it right there. Long time. That's been our home for 20,000 years. A long time ago, according to the treaty, we supposed to own all of that, but we don't, unfortunately. Here's our area of our traditional land, how what our Habenapo, Kulanapo, Lilik, our area. Each tribe had different areas of the lake, but specific here to us. But you could see like there's a little small square there is what we only own now. So I'm gonna take you closer into the rancheria so you understand more about our things. You could see our wetlands to the left and then our development, housing, and a casino. But I want to take you to a special place here, an area where we pray to Mother Earth. It is a roundhouse where we take our money to the roundhouse, and there's a little square that you see there where the entrance, where we're dancing inside, and we call the spirits inside to give us advice for medicine. So here inside the roundhouse where you saw, this is our dance. This is where we see and gain the medicine from the fire, from the dancers, from the people all around donating their money, their money. And the dancers on the left is the leader, and on the right is the big head. And this is called the religion of the dreamer. We call this the dreamer dance because in that whole process of suffering, 3 nights, Thursday, Friday, Saturday, and then Sunday of constant dance, we're praying, and we're watching, and we're helping. And after on Sunday night, that is where you fall asleep. And then hopefully in the dream, the spirit will come to you and tell you the dream of the medicine, how to create the medicine. So a few days after, or however long a period of time passes after the ceremony, now people come together like how we are now, and you could see him from the photo, there is a man speaking, but beneath him, there's baskets. You see those baskets? Those are the tooling now to make dreams come true for the medicine. So I'm going to share here with you this basket here. If you could look at my video screen, this is a basket that the dream given by the creator to remove the sickness, the tooling, but then from the prayer to look in the sky and to see the diamond, blue, blue, like the rain, and then white, like the clouds, the snow, and then red, the body, the body. So the millions and millions of feathers, the millions and millions of microplastics to remove the sickness now, to remove the sickness. That is what makes the basket so beautiful. But then here, the Pomo trick now. You must make a dream come true. Once you have the dream from the spirit, you must make it come true in the real world. This is heavy. That is the old medicine, where now we move into new medicine, new medicine now, where many like me from around the United States, even Hawaii, come together because we know there is a off in the world. So to monitor from our prayers. And what do we pray for? Clean water, foods, clean foods, medicine, and always the people to look after. So our project here, we are praying for clean water in the sky and soon water in the bodies. So with NAFP and these tribal people from different parts and Stanford University, LaBeaud Labs coming together to make a national Indigenous Microplastics project. Now, we know in our generation that the garbage patch did not exist in our parents' generation. but it will exist in our children's generation. And the sickness from the world. Remember, the Indians prayed to the world, and we see the sickness. It's too obvious. Now try to be proactive. Many are afraid. This is a lot, but understand the Indians and others are not. We want to know more about this. That's what gives rise to our project, because the chemistry of this. And I want to show you, if you want to see more of our map, of our thinking of this, I won't explain it too much. Visit our website, okay? Next slide. Well, you can see our sampling sites. They're all listed right here. All of the participants that took place, and they're all tribal communities. Just, it really was just wanting wanting to know more. So we took the active step. So when we think about what we're actually looking for, when we take the rainwater sample or the snow water sample, we're looking for some very common plastics, PLA and PHA, that readily break up into microplastics. Designed that way, designed specifically that way. So we want to see if it's true or not in the environment and in the human body very, very soon, because PLA, PHA, those are single use, like forks, bowls, clamshells, and they're very acids in the body. I won't speak of that too much, but the state does have a toxicology lens now on that. I'll speak more later. So our collection method, it's trailblazing. I say that because it's a Native American way, because right now there are no policies, procedures for rainwater sampling, collection. So tribes have EPA departments and others have policy, have sampling procedure. So when I say trailblazing, these tribes are the ones developing this now as we proceed. Our sampling procedure, I show for you here right now for the rain. This is for the rain collection at different locations. Um, it was very simple. No plastic, right? Either metal or glass, and leave out until it rains. Collection method, right? For the snow, this is how we did too. Just kind of leave out your pot, your bowl, and then just, we have a sample jar. Each person had a sample jar that's the lab provided. Um, there we go. I'll show you that. There's the jars right there. They filled up the jar with the liquid, snow or water, and then sent it to LaBeaud Labs at Stanford for analysis. And there's Desiree and Amelia at Stanford LaBeaud Labs, and there's the microscope. And that's what we're kind of focusing on. On year one is pilot project and just presence, absence, presence, absence. And I'll share that information with you here very soon. So there's me and Amelia inside the lab. Amelia analyzing samples. And this is what we found. I'll share with you what we found. There were concentration levels collected at each location, but we want to replicate and reassure before we share our concentration values. So we're just showing you again, presence, absence, what was inside. So number one was thin film. Lots of that from baggies, water bottles, all kind of plastic bags. Number two, fibers, like from the clothing, from the textiles. We know that. And the length of the fiber is eye-catchy towards the human health aspect. because the length, again, to pass through the body, something else. But then the fragments, there's a lot of fragments, meaning all different kind of plastics all coming together based upon some kind of probably charge or something, ionic charge, all kind of just coming together. And then there's clusters. Now clusters are colored black. You can see them. They're black. What does that mean now? Is their questioning towards human health. They want to investigate perhaps virus or bacteria or some type of living culture, a different area of research, different areas of research. Okay. So there's a lot that needs to be done, like identifications of the thin films, of the fibers. What are these fragments? Um, more uh, instrumentation, more instrumentation and techs, lab techs to start more investigation into these microplastics that are present. They are present. Okay. So when AB 389, this is the beautiful part about our project, where again, I said that the bear doctor, to give to tribes what they want. It is data sovereignty, data sovereignty. And what does that mean? Ownership. But because of new policies that when tribes and universities work together because of AB 389, that the data belongs to the tribe. It's simple as that. So understanding those ways, try to implement those ways. That's what here I want to share with you, because the data sovereignty is what beautiful things that then come to us. So I'm showing you here a data sovereignty agreement between LaBeaud Labs at Stanford and the Native American Fiber Program. It's been signed, which means that when the tribe sends the sample under the NAFP, there's under the NAFP, when the tribe sends the sample, that the data generated from the sample belongs to the tribe. And then also co-authorship. The tribes are included, and the tribes control the narrative. Take a screenshot of this so you could see this. So you could, because this is heavy here, data sovereignty. And plus, when they researchers go for some type of grant, they must include us in the budget, a line item. That is very fair. That is data sovereignty, where others then can understand. So understand this, that there's one data sovereignty agreement between NAFP and LaBeaud Labs, because it's difficult for LaBeaud Labs to control all those tribes, right? But easy for NAFP. And I'll show you. Now there's a second data sovereignty agreement where NAFP and the tribe, now tribe in paper, you own everything. NAFP just generates the data for you to participate. And I'll show you how we will generate data and how we want to share. But the most important thing is data sovereignty here, which I'm trying to show you. Remember, only Bear Doctor could do this. And this is a data sovereignty agreement with my tribe. With my tribe. It hasn't been signed yet, but they're already doing it. They like the idea, and we're going full speed ahead. We just had a meeting last week at our tribal casino, and we talked about this as well. So here's the template that other tribes can see and understand that it is our time. It is our time now. Data sovereignty with microplastics. So we did the environmental testing. right? The rain and the snow. But then, according to SB 54, there's that health aspect. And we all know now that microplastics are in the environment and in our bodies. So we will be approaching this evolution in human history to start testing our bodies. But remember, we're trying to develop the cure. We're trying to remove the sickness, and we will need some participants. Now, I know my tribe is ready to go about providing. Remember how we do it at our place on a prayer from the rain, then now from the water and the body, the urine, the urine. So my tribe, we are prepared to move forward, but we're always seeking others to volunteer for this and to hopefully we'll have a consent form. You could come, sit, and talk more about our project, drink some water, drink some coffee, drink some juice, and eventually you'll have to use the restroom. We'll have the form ready for you and a stipend. That's so important to part in consent, a stipend to go about this. So that's our future evolution in medical, old medicine and new medicine. So yeah, let me go on to the next slide. And our data. How do we share our data? How do we share? We would like to create some type of map um, where we could develop some type of concentration values once we've known how much rainwater, 1 inch of rainwater, for example, contains X amount of microplastics. We could develop some type of map like that to monitor. Is it getting better or is it getting worse? Are we being more proactive at this? So, as our nonprofit, we are Native American, federally recognized. You saw our map. It's a national. We have some national. We're gonna connect with EPA, Tribal EPA Region 9, and eventually, hopefully, we're gonna grow into a monitoring network strategy, tribally led, that we could develop some type of map just like this. And that's how we would like to share our data, just like this. So yeah, next, let me move on. So here I want to show you our current data sovereignty model as the Native American Fiber Program is the program lead, and we work with our tribal partners. You saw a lot of them, and we hope to include, California Indian Basket Weavers Association next year, and others, and all different type of tribal peoples, and have them. We work with close LaBeaud Labs for the analysis, and we create some type of mapping model, data sovereignty, and publication. Of course, we want to start publishing soon, and we will be having our signing ceremony at Stanford for our data sovereignty agreement very, very soon. So I'll talk about that one day in my um, presentation in the future. But next slide. And that's my last slide for this presentation. I just wanted again to say thank you. Scan the QR code to visit our website. And I think, oh, that was only 30 minutes. But if there's any questions, um, feel free to ask.
Yeah, y'all are already doing it. If you want to raise your hand so we can make sure everyone gets a chance to speak or add your questions into the chat, we can go from there. It looks like Cara, you have a question. Go ahead.
Sure, thank you. Really interesting presentation. Thank you, Fred. I saw a presentation recently on microplastics for drinking water in particular, where they had their analysis method required, I think it was like 500 gallons in order to really quantify the amounts and the different types of plastics and stuff. Um, so I don't know if you've talked with the LaBeaud Lab about that in the future, if a larger scale collection of water would be might be happening.
I think that really depends on the methodology. And I know for sure it took us almost 2 years at Stanford to develop the steps to where we are right now. And that methodology, it didn't really exist at our lab at LaBeaud's. So that's the whole thing again. It's kind of wide open, especially for rain and snow. So the tribes trailblazing, leading the charge. And I'll say for our example, or for our project, the total volume of the sample was like 500 mils. And they even said that was plenty. Thank you for your question.
Just flagging Fred, you've got some love in the chat saying that this was a wonderful presentation and all along while you were presenting. Evelyn, go ahead.
Hi, Fred. Thank you so much for that inspiring presentation. I'm wondering what area you're in and what public utilities are nearby you, and if you work with some of the larger public utilities who are working on this. I mean, about a month ago, I went to the Metropolitan Water District's water treatment plant in Vernon, and the head of the lab was gave us a presentation as part of the day, and I just felt like the two of you should connect, or you could connect with his with the lab there. It's, I mean, first a tour and then maybe some kind of collaborative relationship. So I just wondered if you're already doing that kind of communication with utilities that are in your area, and where are you located?
Well, right now I'm in Clear Lake, which is Northern California, about 2.5 hours north of Sacramento right now. And I know that the tribe, we have a water treatment plant. Our tribe has not taken that approach yet to start testing the drinking water yet, but we will. So I could see your vision of working with different types of water utilities, because see, that's an important part of our project is the health exposure pathway. Because in California, a lot of our water comes from the reservoirs, right? And the rain and the snow. Mm-hmm. So just to monitor the influent, what is it looking like coming in? Yeah, I was a water operator before. So I understand the importance. Hopefully, if you want to connect me with some people, I would
I
really
would love to. How
appreciate
are you
Evelyn.
going to provide your number, or can we find it on your website or your email or?
Hey, yes, visit my website and our email is there on the contact.
Okay. Thank you. Thank you, sir.
Thanks, Evelyn.
We've got hands coming up in the queue, but I also there's a good question in the chat that I'm gonna read aloud, and if that person wants to um, unmute and add to anything, please feel free. But if you put something in the chat, I'm going to assume you want to remain anonymous for the recording. So I'm not going to say names or anything unless you opt into that. So this person said, "Thank you so much for leading this effort. I see that you're finding fibers as the #2 category of microplastics. And I'm wondering if you're thinking about expanding the polymer types. Sorry, I have to scroll. Expanding the polymer types you're looking for beyond PHA and PLA, since those are not typically used in apparel and textiles. PP, PET, and nylon tend to be the more likely polymers in apparel. So are you planning on extending?"
Yes, we are. There's so many different types of microplastics, fibers. I think there's like 1,500 just different types of plastics. So, and how many different types of fibers? That requires so much research work. And so I thank the state of California for these opportunities for funding with SB 54 to potentially research into that and create a library
Mm.
methodology of how to test for all the 1,500 microplastics, how to test for all the how many fibers that there are out there. So I can envision a whole entire laboratory of different students researching all those different types of fibers, thin
Mhm.
films, P, PLA, PHA, PET, all everything. So hopefully we receive some funding to do that type of research with NAFP and Stanford with our water samples. Thank you.
Mhm. Okay, Darlene, you have your hand up. Go ahead.
Do I understand you right, Fred, that you are looking for people to participate and sign an agreement to find out what is in our bodies? And if so, from out of state, out of California as well? And where could we find the application to participate?
I love that kind of question.
Thank you.
Thank you for being the first one to step up, the brave, the willing, to never have fear. You just want to know.
Yes.
Uh, we're going to evolve. Right now, I just wanted to kind of make a small announcement on that, kind of just float the idea by everybody. How do you feel, everybody? Because this affects us all. And we have to do it in a consent way where we all agree. You sign the form, you're even receiving a stipend, like it's a fair, it's very, very fair. And we work together to develop the cure. So you could visit our website, NAFP, our Native American Fiber Program.org, and email me, and I'll put you there on the list of the brave. Um, Darlene, I'll put you there.
Thank you.
Thank you.
Great question. Thanks, Darlene. Next up is Teresa.
Thank you. Hi, Fred. I wanted to introduce myself. Thank you, Evelyn, for mentioning my laboratory and Laverne. I'm with the Metropolitan Water District of Southern California, and we've been working on developing analytical tools for measuring microplastics in drinking water sources since 2018. It's challenging. And so I understand the slow pace because it's research. And so if we go too fast, we're going to miss steps and critical important information may be omitted from trying to understand the impacts on the human health through drinking water. So I also wanted to address the comment about drinking water sample collection. Drinking water treatment does remove particles, and preliminary evidence does suggest that those particles include microplastics and potentially nanoplastics. The microplastics and nanoplastics are super sticky. So the analytical tools for measuring them are challenging. So you have to have a lot of water to concentrate it because they're in such a small amount. Your likelihood of finding them is greater with the more water that you collect. Aerosol deposition and everything, even in your room in front of your computer with your teacup, it's a lot, there's a lot in the air. And so like Fred said, you probably need less water. Um, anyway, I had a question too. Um, what is the medicine for removing microplastics from the body? Has this been revealed yet, Fred?
I love your approach, Teresa, of the how you approach it through a scientific standpoint, the water and your volume. But I just want to remind you, see how our volume was and what we saw in there. So there's some bridge building. We need to have, this is perfect. We need to have more of this so we could talk to start developing the exact analytical methods now. And I think that's the medicines, right? We have to start coming together to develop a standardized test methods, and so that we could understand more of exactly the microplastics that we're dealing with, the presence, the absence of which ones, and then developing some types of tool, the medicine, the tool, how to remove that. So I'll tell you like this, as a water operator, I understand what you're saying. They're coming through the plant, the filter is catching it. It's typically the green sand filter, right? But then what other else type of filter would be needed? And only you'll find that if you have to test after, where it's like the potable now. You see what I'm saying? So that filter in between, maybe after, will you need it or not? I don't know. But that is the medicine, the tool. But you have to research more and collect more samples. I hope I explained that well. But we should
Yeah,
have
I
more
understand. Yeah, I do. The medicine is continuing efforts to understand and explore. You've got to develop the methods first. I mean, in drinking water, we don't want to send bad data out there. Oh yeah, well, 99.9% of our samples get contaminated by microplastics in the air in the lab. And so what does that mean? So we need to understand that too. And so there's a lot of implications in terms of evaluating it from a public health perspective in drinking water. So we're working on it. It's taking time, but yeah, uh,
quality
Thank
control.
we got the medicine going.
Yep. Yeah, quality control. It's all about quality control, especially right now. So when our approach, NAFP, we went with Stanford, right? Yeah. Mm-hmm.
Thanks, Teresa. I just want to elevate a few more comments in the chat before we get to you, Andrea Beth. Someone said, thank you so much. Will a recording be made available for sharing? We are recording this and we'll work with Fred later to figure out how he wants it to be shared and distributed. So hang tight for that.
Well, you could share
Um,
it, distribute it as normal.
okay,
Yeah,
great.
as normal.
Then we'll post it on the Water Quality Monitoring Council YouTube webpage, and then Fred can link to it on the NAFP webpage if you'd like, and that sort of thing. We can also, when the recording is available, we can send an email out to everyone who registered for this amazing webinar, so you'll get it directly in your inboxes. And then another comment in the chat, just a welcome paradigm shift, being open to knowledge from many sources. And then someone said, agreed, with lots of exclamation points. And then before I go to the other comments, Andrea, you have your hand up. Hopefully I pronounced your name correctly.
You had it right the first time. It is Andrea Beth. Thank
Okay.
you. Thank you so much, Fred. I'm deeply moved by the work that you're doing. I serve as a director on my local water district here in San Diego County, and I'm always interested in finding ways that we can do outreach to our indigenous communities in San Diego County. You likely know that San Diego has more um, different tribal communities than any other county in the state. So if you have any, is there any way that I can do some outreach or help you reach out to broaden your reach in the research you're doing?
Yeah, sure, Andrea. Thank you for speaking today and your willingness to help. You could always visit our website and email me. And I do know some people from tribal people from San Diego, Morongo, and we even had a sample down in your area, La Moretta. And where I'll just let you know what we like to do is get together for basket weaving events. And so maybe one day when we have our basket weaving event, you could come and speak and introduce yourself down in the San Diego area. I think we'll have our next event maybe next year in the January, February during the cooler times. Um, but
Wonderful. I would
thank you.
love that. Thank you so much.
Thanks, Andrea Beth. It looks like we've got some more comments in the chat. Someone said, wouldn't it be cool if hemp plays a role as filters are developed? And then someone else said, just thank you in the chat. And I think I'm caught up. Did I miss anyone's comment or question in the chat? Feel free to re-type it in, or if anyone else has questions. Yes, Charming, please.
Hi, Fred. I just want to say this presentation was wonderful. And I work in water. I chair the water committee for Sierra Club, but I don't work for Sierra Club. I'm a volunteer, but I work in water. And on my job, we're actually working on something to remove microplastics from the ocean and from water bodies. So, and I can contact you through your webpage. But I just wanted to ask, would you be willing or interested in coming to present to our company when we have our retreat, which is normally in November? Would that be something you'd be interested in?
It sounds very interesting, charming. It's very charming, by the way. Yeah, thank you. I really appreciate your comment. I would like to present. Why don't you contact me again? Visit our website, and you can contact me, and then we'll get some conversation started, and we'll figure out how to work together. But I'm very thankful that you're here and that you really had the feeling for this. So yes, I like to work with you. So thank you.
Absolutely. And I'll be one of those signing up for the testing.
Yeah. Uh-huh. Thank you. Thank you. We need more like you. Uh-huh.
Amazing. Another thank you in the chat. Thank you for bringing this important information to us. What a wonderful program. Best of luck to you all. And then you've mentioned a couple of times, Fred, for people to go to your website. So I added a link to the contact page in the chat, as well as the email address that's listed on that page, which is nafp.ceo@gmail.com. So folks can get to them emails as quickly as possible so you can make all those connections. Another comment in the chat before we go back to hands. Which I already answered. So Fred, might you share your contact information? Done. Look at that. Thank you for your very informative and inspiring presentation. And someone asked to share the QR code to sign up and participate. So I can, if that's available on the website, I can look that up as well. Or if you want to reshare your screen for a moment.
Do I have the QR code? Let me see here. I could reshare.
And if not, then the email that we provided in the chat is a
Yeah.
good
Does that
way
work for
to.
you?
It looks like Zoom has a lag. The
Oh,
screen is coming, but I don't see it yet.
oh, it says paused.
What?
Well, you could always visit our website, nativeamericanfiberprogram.org. Yeah, it says pause for some reason. Let me try again.
That's right. Okay, Lori, go ahead while we're getting this up. There it is.
Perfect.
Hey, thank you. I just wanted to add to the chorus of thank yous, Fred, for your presentation and just sharing your perspective and the work that you're doing. I don't have any specific questions at the time, but I just wanted to say that this is really amazing. I think that what you're sharing right now is sort of really touched many people, and I think there were over 200 people that signed up for this webinar, and I'm happy to continue supporting as part of the Monitoring Council, continue discussions, with you and your team. I also wanted to thank you for your perspective, just being a member of the Monitoring Council. You've really brought some just an amazing perspective and um, information to the council and the work groups.
Well, thank you, Lori. You are the director of the Monitoring Council. Thank you for this opportunity. Um, I know in the future we will have more presenters, not just me, but other tribal people, and hopefully we could start building more on this because Native American people are um, peoples that do collect water quality data. And how do we share? There's always this unique way. And you gave us that way here today, Lori. So this is the first of many. So I strongly feel this is a very successful meeting. We had, like you said, we had 200 people sign up. And right now I think we still have 80. That's very, thank you to everybody who joined. And I hope you were excited, and we're going to have more presentations coming very soon. So again, thanks, Lori. Thanks, Anna.
Yeah, I was keeping track of the participant number as you were presenting, and I think we got close to 100 when we had a lot of people. Yeah, this has been great. Patty, please.
Hi, yeah, Fred, thank you very much. This is quite a endeavor. More very impressive. One question I had was, so your next step, if I'm understanding, is you're going to be, or part of your next steps is looking at urine samples and seeing what actually comes into the body. And my I'm wondering, the urine samples, that sort of represents what passes through. Are there any considerations? I mean, I know this is like a massive project, but like sort of what are your next steps looking like? Maybe what stays in that's related to microplastics? What stays with the body?
That's a good question. And again, today was just kind of an announcement.
Yeah.
Um, but remember, our project is based all on a prayer. Water in the sky, water in the body. Are they clean? Methodologies for all that right now for the urine. It's kind of in big hush hush, I want to say right now, because we're not there yet to share
Mm.
enough, but we have an understanding of an approach of how to test, how to collect data, how to be impactful. But I will say this from other studies, because you want to know inside the body, right?
Mm-hmm.
The way is to test the blood. Now, the test methodology for microplastics in the blood, there's a high interference. So therefore, the data detection of the quantification, high interference
Mm-hmm.
because blood microplastics, it interferes when they're the particle size. It's
Mm-hmm.
semi difficult to get accurate data inside the bodies at times. But our focus again, the urine for our project, water quality, water quality. I can tell
Yeah, just
as it evolves, as it evolves.
Mm-hmm.
Hmm.
Just to add to that conversation before we go to Jerry, through our California Bioaccumulation Monitoring Program, we have become close partners with Biomonitoring California, who does that type of work. They test blood and urine for all sorts of yucky things. And so, Fred, I'm happy to connect you with my contacts in Biomonitoring California to see if a partnership might grow there moving forward. They've been good partners for us. So I can pass along that information too. You're going to be getting a lot of emails. Watch out.
Good. Thank you for everyone's participation. Thank you, Patty.
Thank you.
Jerry, you had your hand raised?
You're on mute.
Here, I'll ask you to unmute. Hopefully a box
There it
pops
goes.
up. Here it is.
Apologies. How's it going? Good day. My name's Jerry Sanchez. I'm from Houston, Texas. I'm in the Calmeca Indigenous Organization and Houston Aztec Dance. I'm a medicine person. I just want to say thank you to Mr. Briones. It was really, really great information. A lot of stuff you said really resonated with me, especially about the stuff about the dreams and Uh, I just wanted to ask, uh, I know this is just the start of it, just the beginning, but what do you foresee maybe in the future, well, like when we get our outcome, what do you think will change? Like, do you think we might get rid of plastics, or what do we have to do to heal, to fix this problem? And I'm just wondering if you have an idea of maybe in the future what that might look like.
Well, first and foremost, Jerry, I want to say thank you. And for everyone's information, Jerry was a sampler out in Houston. I've worked with Jerry on several indigenous projects in the past. So then when it came to this time, I said, hey, let me call this Jerry up so to be a sampler again. So he's a very special person. He's a medicine person. And what we have right here is always just this connection of information and sharing. And I know together and an approach of our old indigenous ways of inclusion that we will develop a cure. We will develop a tool to remove the sickness, the medicine, the medicine. But here, an important part, this is kind of our first time talking a little bit. We need to talk more so we could be more proactive. You and I know as indigenous peoples, there's other ways of living of how to without plastics, and we must share like how we are now. We're sharing our ways. So more sharing. That's from the dream, the medicine. So thank you, Jerry.
Thank you for the bear medicine.
We're gonna do this next year again. So everybody get to know Jerry from Houston, Texas, Azteca people.
Oh,
A couple of elevating some more comments in the chat before we get back to those hands. Thank you for creating a space that brings everyone together to find solutions. Your dedication is truly inspiring. We got some links. We've got a couple of thank you so much. Thank you for the work, Fred, and everyone here. This person is currently led to believe that micro and nanoplastics are a major threat to environmental and human health. A toxicology conference held a couple of months prior in San Diego brought forward a lot of epidemiological evidence. Ooh, that's a $5 word. That's a hard one to say. I'm happy to share links published studies and look forward to reading more about the research discussed today. I'll also reach out to help with sharing methods, results, and future goals. And this person added their email to the chat. So we'll get that information to you, Fred.
Thanks, Anna. Thank you for everyone in the chat room.
Yeah. Darlene, your hand's raised.
Yes, I was going to just say another way to grasp what's in the body in terms of plastics or other contaminants is, and especially at Stanford Hospital, to get waivers from patients that have masses or organs removed to be able to analyze those for plastics. That's another way to find out what's in the body.
You're absolutely right. Yeah, thank you. And Darlene, I know you signed up first.
Well, that's the organ. I mean, that's the
Hmm.
urine sample. I had a mass removed, and I was hoping it would be analyzed for plastics or other pollutants. It went to a lab that did not have that equipment, unfortunately. So I did not get the information back that I wanted, but that's very possible to do in a hospital setting.
Yeah, I understand exactly what you're saying. Don't give up because the equipment, um, Some places have it, some places don't. But the testing of that, like that, on those cancers in the body, I'm sure they'll start doing that one day too. Yeah,
Hmm.
'cause remember, microplastics in the body, that's just not normal, right? That's not normal.
Hmm.
But it's something we have to figure out and deal with. So again, Darlene, thank you for being the brave.
Another comment in the chat. Hi, Fred. I'm interested in the traditional basket weaving materials. Has industrial fibers ever been used during weaving? Or if there's a traditional method of creating materials that's still alive and well in the tribe?
Okay, that's a good question. I'll share this basket with you. This basket here is made from red bud, the stitchings, and white willow stick, and feathers. And it's very important in basketry to understand the seasons, right? To go collect with the earth to make toolings. So when you can understand the timings, the seasons, the toolings, and exactly what you're trying to do with that basket, goodness, medicines, make dreams comes true, help other people, the earth will see you, what you do, and open themselves up. The earth will open themselves up to you even more. So it is very important that these natural materials are still on this earth so that we can have those connections, right? Understanding those pathways to the medicines. So, um, yeah, visit our website. We also have a YouTube channel, I should tell everybody, Native American Fiber Program YouTube channel, where we have indigenous basket weavers from all over California, and they talk about their baskets and their culture, whatever they want to share. So visit our YouTube channel. We have so many basket weavers there talking about California Indian basket weavers and the culture. So thank you. Yes.
I added a link to your YouTube channel in the chat, and you also mentioned the California Indian Basket Weavers Association earlier, so I added a link to their website in the chat as well. And evidently, in a couple of weeks, they're having their 35th annual gathering. And on June 20th, things are open to the public. So there's information on that on their website if you want to learn more about basket weaving as well.
And that organization, thank you for mentioning that because that Indian organization was founded on pesticides activism, pesticides on our basket material. And now that was a long time ago, but now our generation, our time is microplastics. So we want to be involved. So I will be presenting there also as well. And Cal EPA, Maurice Lyles will also be there as well. And we'll be trying to bridge gaps, how to make this our tribal peoples samplers, send it into our lab, collect data so we could learn together. Mhm.
Evelyn, I see your hands up. Go ahead, please.
So I really appreciate the person who brought up, I'm sorry, I don't remember his name right now, who brought up what the solutions are. I'm a strong believer that education, we're always, need to stay focused in education. I put a link to a drinking water toolkit that I worked on with MWD that I was hoping you would take a look at, Fred. And I would love your comments on how to even make it better, continue. But I also wanted to bring up that, I go to a lot of conferences and a lot of meetings, and there's always the conversation about communication and outreach and how people, I mean, it requires strategic planning, it requires financial commitment, like everything that achieves success does. But I just wondered if you have put some thought into what you believe would be an effective way to reach communities, to, reduce waste, to trust the things we can trust, to work on the things that we can, as individuals, improve our behavior towards, and, indirectly, maybe even reaching manufacturers to um, take some responsibility. So I know this is a complex and very big question, but I just wondered if you put any thought into this.
Evelyn, that's a good question. I'm glad that you asked that question because I have an answer to your question. The answer is yes, I have. That is why I am a member of SB 54, Plastic Pollution Prevention. Um, in SB 54, it has to do a lot with single-use plastics reduction, replacement, but then also policy, right? Developing policy, influential, being able to speak at that government level with my nonprofit, NAFP, that works with many, many tribes throughout the United States. Um, so we have put a lot of thought into that. I visit our website, you could see some of the policy work that we do, and that's how we know to be impactful in policy, but then also business, where we have replacements to these plastics. And we're also doing research around these plastics. So we tried to be very open to all and have strong engagement because we know as Indigenous peoples, we're not the only one. It will take many people to help solve this issue. It's a global issue. So yeah, I have. That's the answer to your question. Sorry if I'm talking too much.
No, 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 no. Thank you, thank you, thank you.
Yeah, Fred, you mentioned SB 54. So I hopefully this is the right link. I'm doing some guessing as you're sharing with us, but I added a link to the Cal Recycle SB 54 page for people to have more information on that group that you're a part of. And I also added a link to your microplastics awareness page on the NAFP site as well. So those are in the chat for folks.
Yeah, thanks, Anna. This is a huge subject, and we're trying to be very un be engaged with all the different agencies, water boards, Cal Recycle, Cal EPA, Circular Action Alliance, so many different agencies. And to try and bring it all together, it's an extreme challenge, but we're doing the best that we can. If you want to stay further engaged with microplastics, environmental health, Native American basketry, please visit our website. And yeah, this is good. Thank you. And I think we have a hand up. I want to introduce Dave Trottier. He is also a board member of the NAFP, a founder, his tribe from Turtle Mountain, North Dakota, and they're heavily involved with the hemp. And he's here right now, so I want to call on him and see what he says. Go ahead, Dave.
Let me hit the unmute button. Thank you, Fred. Another good presentation. Always a joy to hear you talk, and of course to see your very handsome face. There we go. But thanks for hearing my question. Yes, over here, greetings from the Turtle Mountains of North Dakota. I am David White Thunder Trottier. I am a member of the Standing Rock Sioux tribe of Standing Rock, North Dakota, and a lineal descendant of the Turtle Mountain Band of Chippewa in North Dakota. We have been involved with hemp for the last 4 years in growing hemp and looking at hemp for the answers to many things, not only food, but for the fiber in itself. And I've given some presentations in different venues on plastics as well too, and how hemp, everything made from plastic can be made from hemp. And when I was just looking around, we're looking at the size of what we're dealing with here, Fred, and the microplastics and the nanoplastics and everything. And the answer, of course, is not easy. The prayer, they never did find a cure for cancer, but they found prevention goes a long ways in this. And I think when we're looking at the plastic situation, it's going to be the same way. Prevention is going to go a long way in this. Just sitting at my desk and how much this affects us with plastics. I just look around and I look, my mouse, plastic, my stapler, plastic, the camera I'm looking into, plastic, my laptop, all the keys and surrounding areas, plastic. I got some wipes on my desk in a plastic container. My cell phone, plastic. My readers, plastic. It's all around us, not only at work, but at home, in our cars. I'm looking at my printer here on my desk, a very expensive piece of equipment. Most of it is made of plastic. A great and wonderful invention when it was invented. Strong, lightweight, low cost, and the key point, durable, very durable. And that's the problem that we're dealing with right now that probably no one thought about when they made this thing. Then the presentations I've given on plastic, plastic gets in the air, it gets in our blood, it gets in the sky, it gets in our water, it gets in the ocean, gets in the rivers. And unfortunately, the biodegradability of plastic is a long, long time, anywhere from 400 years up to 1,000 years, which means logically that all the plastic that's ever been made in the 100 years or so since its invention in one way or another still exists. Unfortunately, what we're dealing with is the existence of it inside our bodies now, which is where this problem is. And I think California's approach with SB 54 is going to be take a big giant step in finding some solutions with this. And Fred's involvement with this with the NAFP is going to be big in this as well. And of course, we here in North Dakota with our hemp project are hoping to be a part of that as well. So thank you, Fred.
Thank you, Dave, for joining and being very informational. Dave has a presentation on hemp on our YouTube channel. If you'd like to learn more, visit our YouTube channel and watch Dave's presentation. Thanks, Dave.
I'm on your YouTube channel. I'm gonna see if I can find your presentation, Dave, and I'll add a direct link in the chat for folks as well, but that might take me a moment. I think we're all caught up on the chat. Any other questions? Thoughts for Fred? Okay.
I had a quick question. Sorry, I didn't raise my hand. Still looking for the button.
We'll allow it, Lori.
And yeah. For the next meeting, Fred, how do you have any thoughts about how we're going to get the word out, or like how would you like if people are interested in attending the next meeting, how would they hear about it? Or how would you like them to get the information?
Well, I think we sent it out through the mass email through the water
Hmm.
board the first time, and we only announced once, really, right?
Hmm.
We'll have a meeting, me, you, and Anna, to discuss
Okay.
next steps. And yeah, we'll do that, Lori.
Okay, that sounds good. Yeah, we can send it out. We can post a website. We can add a new page to the Monitoring Council website. There's lots of options. So I think for people who are interested in attending, just as long as you're signed up for the Monitoring Council's email list, you'll get the announcement. But I'm gonna put that link in the chat. So if anybody wants to sign up for the council's email list, so I'll have that handy.
All right. Yeah, again, thank you to everybody who attended. I feel very happy and confident. This was a success. Thank you to the water boards, especially Lori and Anna, and the NAFP board.
This is so good. I invite folks before we sign off, you're already doing it, to give Fred a reaction, some applause, some hearts, whatever. So he can feel the appreciation for his time to share your work with us, but doing so in a way that's just so authentically you and so moving. Just thank you so much for your time and efforts and commitment to this work and being willing to share with this broader community. We really appreciate it.
Thank you.
All right. Is that a wrap? Did we do it?
I think so.
All right.
Thank you, Anna. Also, thank you, Anna, for moderating and answering all the questions in the chat.
Yeah.
I really appreciate you.
No, no worries. Happy to help. All right, folks,
Bye.
have a good rest of your day. We'll get the recording out to you all. We'll also add the links that were shared in the chat and share those with you as well. So take good care, everyone, and we hope to see you next time. Bye, y'all.
All right. Thanks, everybody. Thanks, Fred. Thanks, y'all.